The technology that I'm most excited about, I think, is what's already started now. And so now we have an integration of things like robotics and navigation that are really combined into one system. And so having done surgeries for over a decade without any assist technology, that means placing things like screws and doing correction maneuvers and all that type of stuff. Basically with just our knowledge and with our hands, and not even using as much as X-ray type technology when we didn't need it. Now we're able to do things much more efficiently, more safely, more accurately, and it's really, I think, reproducible for all of us really throughout the world. The huge innovation now in terms of robotic systems especially is that all of our industry partners either have a robot, they're building a robot, or they're acquiring companies with a robot because they realize that one of the big issues, especially with conditions like scoliosis and kyphosis, where the spine is more complex or it's twisted or bent, is it allows us to understand exactly what we're doing before we do it. So we can do basically, it's like practicing before you play a game. We can go ahead and run through the surgery, look at different techniques, different things we're doing. We can see what it looks like, sort of like real time. We then perform the surgery. And in addition to understanding what we're doing before we go into the operating room, we also get sort of real-time feedback to make sure that we're understanding and achieving the goals that we set out to do. We also have additional technologies like rods that are bent into the perfect plane and the perfect alignment, which now takes a lot of the guesswork out that we've previously done. We sort of know generally what we want to do, but it wasn't as precise. Now we know we can place screws incredibly accurately. They're reproducible, regardless of if you're in Nebraska or New York or Miami or San Diego. It's really all the same. In addition, we can look at the spine in 3 dimensions. And so there's other technology out there that allows us now to use augmented reality or virtual reality as we perform surgeries. But very quickly, all of these technologies will be completely combined. And so we call this term sort of surgical synergy, in that we're using many different things at the same time. No different if you're watching a spy show or Jason Bourne or one of the Star Trek episodes. It's very similar. Many things are at our fingertips now, so we can see it. We know exactly what's going on in 3 dimensions, all of which we didn't have just even 10 or 15 years ago. In the next 3 to 5 years, when all this gets perfected, is really going to completely continue to transform how we do surgery. So much better for the patient. Our results are going to be very reproducible across the board, regardless of where you're at, where you did your training, I think, which is incredibly beneficial for certainly our patients, because they're going to know exactly what they're getting, and we're going to be able to give them real-time data. There's a lot of big databases now that say, if you have this and we perform this, you're going to have this type of outcome. Incredibly beneficial for everyone involved, I think.